Hello guys, welcome back to my show, Time with Dr. Nita. This is a show where we talk about women's health, our day-to-day health activities, problems that can arise, and ways of solving them. I would like to thank everybody who in so many ways has made this project a success. Right from the beginning up until now, I've had so many comments, I've had so many views. I'm grateful to everyone who has commented, shared, and liked my page. Thank you. One should bear in mind that a couple's fertility is not one-sided. Research has shown that a third of factors affecting fertility are due to males, the other third is due to females, and then the third that is left is due to a combination of both the male and the female factors and other factors that cannot be explained. So what are the factors that affect male fertility? Male fertility is more about the semen quality and production, and then the second side is about the sexual function of the male. So the volume of the semen produced. From the WHO manual, a volume of 2 to 5 mils is said to be adequate. Usually before you produce a semen sample, it's advisable that you refrain from sex for about 3 days. So if a man produces less than 2 mils, either he did not abstain from sex for 3 days or something else happened. Count. From WHO, a count of between 15 million and 60 million is said to be adequate. If a man has less than 15 million, it's said to be oligospermia or reduced spermia. What happens is that when you produce these sperms, they are supposed to move from the female vagina through the reproductive tract to meet the egg. And let's take, as you grow, people that you are growing up with from the time you started, let's say nursery school, up until now. There are some people who have gone wayward. There are some people who have done drugs. Some people became drivers, some people became teachers, some people became lawyers, some people became doctors. That's exactly what is happening to the sperm. As they move up the woman's reproductive tract, some will fall out. Those are the ones who became wayward or died. Some will get stuck at one place and not move on. Some will move into the reproductive tract, but they will get missing. But inadvertently, some will move up onto the tract to meet the egg. The more sperms that you have per each male, the better the chances are that one of them would meet the egg. That's why you need a certain minimum number of sperms per male to meet the egg. So the minimum number is 15 million. Anything lower than that may affect your chances of fertility. Then we have motility. Motility is the ability of the sperm to move forward. There are so many ways the sperm can move. Some can move forward, some can move in a zigzag manner, some can even move backwards. But the ability of the sperm to move up into the reproductive tract to meet the egg is what we call motility. WHO says that about 50% of the sperm produced should be motile in a forward fashion movement. Then we have the morphology. I'm not sure whether we all remember our JSS or SHS integrated science, but looking at the shape of the sperm that is produced by the males, it should have a rounded head with a long, strong tail. And from research, it's been shown that anyone or any sperm sample that has about 4% good size or morphology is enough to fertilize the egg. And then we also have the color, which is sometimes it's a little grayish or whitish in color. Anything other than that, it must be investigated. When it's very brown or bloody, it may signify an infection which needs to be treated. There's also the presence of white blood cells, which mostly means that there's an infection in the male reproductive tract which should be treated.